So I was in my last year of my doctoral program. I ended up in a central nursing orientations. They had a section on trauma-informed care. And it was all on understanding that our patients, when they walk into our door or wherever we're taking care of them, that they have past painful experiences that are gonna affect how they show up with you in that moment. There was a moment of just, how have I been a nurse for 10 years and have a degree in psychology and not know about trauma-informed care? As I started going in for my shifts, I just started seeing the trauma everywhere. I remember going to my managers at the time and saying, hey, I really think that this is something that we should be incorporating in. A lot of it was, yeah, okay, that sounds great, and right now we've got way bigger fish to fry. We've got way bigger things to focus in on. I was gonna have to do it outside of that current job that I had as a professor and as a nurse practitioner. End of January 2020, I had gone to my husband and said, hey, I'm noticing that there's a lot of trauma, a lack of psychological safety, both on the academic side with my students and with my patients. And I said, if I can match my salary with my business, can I leave? I was the sole income for our family of 5 at the time. I remember him saying, I'm totally on board with this. And also, this is what I need to see for the next 3 months. So March, April, May, this is what I need to see in order to be like, I'm down. So many people were coming to me and saying, hey, you're starting to work with people around trauma, right? And by May, we had quadrupled our business. I turned to my husband, he's like, you can absolutely go. You're good. Had a Zoom meeting with my boss and said, hey, I'm not gonna be teaching in the fall. And then in November of 2020, I went to my clinical supervisor and said, hey, you're gonna have to find another night shift person. 9 months later, I was driving in the car with my husband. We were chatting about kind of just where I was and what I was thinking about. And I was like, I really wanna create something that's bigger than just me. Like, I want it to be not Lacey Cordell. I want it to be a movement, like a community. He's really great at like pulling out the things. So he's just asking me questions, and all of a sudden I was like, oh, I want to start an institute. And he knows me very well. Like, when that happens, he's like, okay, I'm just gonna get out of your way and let you go create something really awesome very quickly. And so an hour later I came downstairs and I was like, okay, the Institute for Trauma and Psychological Safety officially exists. And so we have to tell everyone about this really big shift that we're making in the business. We had no idea how it was gonna be received. We went live in our community and we were describing what turned into our TRIPS program and our teacher training program. And within 4 days, there were 20 people in our community that were like, I'm in. And I said, are you sure it's a 5-figure thing, and like it's an 18-month commitment, and are you sure? And it was just so wild. One of the coolest things that happened is my parents. I can still remember that moment at the table and just their concern and their, okay, but what about all of this that you've done? What's so neat now is when I see my mom share our Institute's Facebook posts on her page. And she's like, hey, all of my friends in healthcare, like, you should totally come to this event that the Institute is putting on. And I've also sat at the dining room table with my dad and had some conversations around my childhood and his childhood and like where some of the traumatic and dysregulated things happened. And I never thought that we would end up having those types of conversations. And to see people who were legitimately concerned about, is this something that people need, to then be so supportive and so on board with what we're doing, like, it means more to me than I can express. When people learn about the Institute, I think the thing that I want them to know is that there is absolutely something magical about trying something and having it help you right away. Those little moments of hope, I actually think that those are the moments where I go, this is really working. And even if it's one person and one moment at a time, like, that's more than enough.